This webinar is intended for all healthcare professionals who care for individuals with serious and life-threatening illness. Many individuals living with serious illness have previously discussed their wishes for medical care in the event of a life-threatening event. Many have documented their wishes in a post form or other similar documents. For the purpose of today's webinar, I will specifically talk about post, but the concepts discussed today can easily be adapted to advance directive, living will, or other medical orders for life-sustaining treatments. In an emergency, it can be challenging to know how best to incorporate information documented on a post form into the context of the current clinical situation. This is especially true when limited or comfort-focused treatments are prioritized. In this webinar, we will provide a simple framework for navigating these conversations. The goal of the post form is to document wishes for medical care in an easily accessible form so that these wishes can be honored in a medical emergency. For a variety of reasons, wishes may change over time, and post may no longer accurately reflect a patient's wishes in the moment of crisis. When providing emergency care to a patient with a post form, it is important to confirm values and align treatment to honor patient preferences. This is especially important when patients have decided to limit aggressive medical therapies, often designated as limited treatment or comfort measures only on the post form. In this setting, a quick and easy framework for addressing preferences in the moment is necessary that does not undermine a previously made decision, that validates patients' current preferences, while also allowing for prompt delivery of medical care that is consistent with patient preferences. Here we introduce the framework for honoring previously determined preferences for medical care. This framework includes 4 parts. The first part is the reminder of previously documented decisions. Start by assessing if the patient remembers that they previously had a conversation with their healthcare professional about their goals and preferences for future emergency medical care. For example, do you remember talking with your healthcare professional about the types of medical care you would want if you were to become very sick? Or alternatively, do you remember completing a post form? If the patient remembers, ask them to describe what they remember from the discussion. For example, tell me what you said. If they do not remember, provide them with the factual information that a form was completed and ask permission to share what was documented. For example, you did complete a form with your healthcare professional in the past that described your wishes for medical care in an emergency situation. Can I tell you what that form says? Share information using short, simple statements, avoiding jargon, such as using allowing death to happen naturally, rather than saying DNR. The next part is to confirm if the information documented remains consistent with the patient's wishes. For example, is that still how you feel? Or alternatively, have your wishes changed since then? It is important that this is asked through an open-ended questions to avoid imparting disagreement or judgment. It may be that the patient's current wishes aren't consistent with the preferences documented. It may also be that the patient's wishes have changed. The next part is to align patient preferences in the context of the current medical situation. This includes both validating the importance of the patient's decision, as well as putting that decision in the context of the current medical situation. Validation is important to show the patient that they will be cared for regardless of their decision. For example, I respect your decision. Or alternatively, I respect that you're feeling differently now. It is also important to make clear that the patient's current medical situation is an emergent situation where the pulse decisions will come into play. This is no longer a hypothetical discussion. For example, you could say something like, I worry that we are now in a place where we need to act on these decisions. The final part is to offer a plan for future treatments that aligns with patient preferences. For example, you could say something like, is it okay if I make a recommendation? Understanding your wishes and also seeing how sick you are, I would recommend that we... How does that sound? If the patient's current wishes align with the documented preferences, then the plan may consist of specific ways in which you will provide care consistent with the patient's wishes. If the patient's wishes are ambivalent or differ from the documented preferences, your plan will be that a goals of care conversation will be needed. There is a separate framework that can be used to address goals of care that will not be discussed in this presentation. Let's watch how this framework plays out in various scenarios. Ima Sick is a 90-year-old female nursing home resident with COPD on 2 liters of home oxygen who was brought into the emergency department by EMS with fever, cough, and shortness of breath. She is hypoxic with intercostal muscle retractions, but she remains able to participate in conversations about her care. She has a pulse stating DNR with limited treatment. For this first scenario, Ms. Sick remembers that she completed a pulse and her current preferences for medical care during this emergency situation are consistent with her prior wishes documented on the pulse form. You will now listen as Dr. Brown, the emergency room physician, discusses with Ms. Sick her previously completed pulse form using the framework. Pay close attention to how Dr. Brown uses an open-ended question to confirm Ms. Sick's preferences in the context of her current medical situation.
Hi, Mrs. Sick. You are having a very hard time breathing, and I need to talk with you about what this means.
Okay.
Do you remember talking with your doctor about the type of medical care you would want if you were to become very sick?
Yes, I remember.
After that conversation, you put your wishes into writing on a form called a pulse.
Oh yes, I remember that.
Can you tell me what you said on that form?
Well, I knew my breathing would get bad again one day. I've been on that breathing machine once before and I didn't like it. I told my doctor that if I were to get sick again, that I wouldn't want machines keeping me alive. I would want to die in peace.
I see. Have your wishes changed since then?
I still feel the same way. No machines.
I respect your decision to focus on feeling comfortable at the end of your life.
Thank you.
I worry that we are now in a place where we'll need to act on these decisions.
Ooh, I was worried about that too. What does that mean?
Is it okay if I make a recommendation?
Oh yes.
I am worried that your breathing may get worse very soon. Understanding what is important to you, I would recommend that we do everything we can to help your breathing feel better. This can include medications, oxygen, and breathing treatments. If your breathing gets worse, this will mean that you are dying. We will not use life support, and we will help you feel peaceful. What thoughts do you have about that?
Oh my. I didn't realize how serious this was. This is very scary, but what you recommend makes good sense to me. Did you notice how Dr. Brown used open-ended questions to explore Ms. Sick's understanding of her previously documented wishes? He said, do you remember talking with your doctor about the type of medical care you would want if you were to become very sick? He also said, can you tell me what you said on that form? Did you notice how Dr. Brown validated her decision? He said, I respect your decision to focus on feeling comfortable at the end of your life. Did you notice how Dr. Brown suggested a plan for future treatment that aligned with Miss Sick's wishes? He said, I am worried that your breathing may get worse very soon. Understanding what is important to you, I would recommend. For this next scenario, Miss Sick does not remember that she completed a POLST, and her current preferences for medical care during this emergency situation are not consistent with her prior wishes documented on the POLST form. You will listen again as Dr. Brown discusses with Miss Sick her previously completed POLST form using the framework. Pay close attention to how Dr. Brown responds when Miss Sick states she does not remember completing a POLST form in the past.
Hi, Mrs. Sick. You are having a very hard time breathing, and I need to talk with you about what this means.
Okay.
Do you remember talking with your doctor about the type of medical care you would want if you were to become very sick?
No, I'm sorry, I don't remember that.
You did complete a document with your doctor during your last hospitalization that described your wishes for medical care in an emergency situation. The form is called POLST. Can I tell you what that form says?
Yes, please tell me what it says.
Your POLST form says that in a situation where you are very sick, you would want treatments that are easy to tolerate with the hopes of getting you back to you. You would want to avoid treatments like breathing machines. If your heart were to stop beating, you would want to allow death to happen naturally. Is that still how you feel?
Wow, that doesn't sound like me. I've been on a breathing machine once before. It wasn't fun, but I wouldn't be alive today without it. I've had a few really good months since the last time. I would be okay with doing that again if I could get a few more good months. I'm not ready to die.
I respect that you are now feeling differently. This is very scary.
Yes, thank you.
I'm worried that your breathing may get worse very soon. We are now in a place where we will need to make some tough decisions about your medical care.
I'm worried about that too. What does all this mean?
Is it okay if I make a recommendation?
Oh, yes.
I'm worried that your breathing may get worse very soon. Understanding that you are now feeling differently about the type of care you want in this situation, I would recommend that we start some medications to help your breathing feel better. Then we can continue this conversation about what is most important to you. If your breathing gets worse, we might need to use the breathing machine. What thoughts do you have about that?
Well, I think that makes sense. I hope I don't need the breathing machine, but I'm not ready to die. Did you notice how, when Miss Sick could not remember completing the POLST, that Dr. Brown provided information on what was previously documented? He said, you did complete a document with your doctor during your last hospitalization that described your wishes for medical care in an emergency situation. The form is called POLST. Did you notice how Dr. Brown normalized that decisions can change? He said, I respect that you are now feeling differently. This is very scary. Did you notice how Dr. Brown's plan was to engage in further goals of care conversation? He said, I would recommend that we start some medications to help your breathing feel better. Then we can continue this conversation about what is most important to you. For this last scenario, Miss Sick does not have capacity for decision making, and therefore, we are speaking with her daughter. Her daughter is not aware that the patient completed a POLST and not familiar with the patient's previously stated preferences. You will listen again as Dr. Brown discusses with Miss Sick's daughter using the framework. Pay close attention to how Dr. Brown responds when Miss Sick states she does not remember completing a POLST form in the past.
Your mother is having a very hard time breathing, and she is not thinking clearly enough to talk with me right now. As her surrogate decision maker, I need to talk with you about what this means.
Okay.
Have you ever had a chance to talk with your mother about the type of care she would want if she were to become very sick?
No, I'm sorry. We never talked about that.
She did talk with her doctor about this during her last hospitalization. Based on that conversation, the doctor documented your mother's wishes in a form called a POLST. Can I tell you what your mother said?
Yes, please tell me.
Your mother said that if she were to become very sick, she would want treatments that are easy to tolerate with the hopes of getting back to normal. She would want to avoid treatments like breathing machines. If her heart were to stop beating, she would want to allow death to happen naturally.
Wow, I can't believe she was feeling this way and didn't tell me.
It must be really hard to think about your mother getting so sick.
Oh yes, it really is scary.
I'm worried that your mother's breathing may get worse very soon. I worry that we are now in a place where we need to honor your mother's wishes.
Oh my, I didn't realize how serious this was. What does this all mean?
Is it okay if I make a recommendation?
Yes, please.
I'm worried that your mother's breathing may get worse very soon. Understanding what is important to your mother, I would recommend that we do everything we can to help your mother's breathing feel better. This can include medications, oxygen, and breathing treatments. If her breathing gets worse, this will mean that she is dying. We will not use life support, and we will help your mother die peacefully. What thoughts do you have about that?
I guess you're right. My mom hated being intubated the last time. It was so hard on her. I can understand why she wouldn't want to do that again. This is so hard, but I want to do what's best for my mom. Did you notice how Dr. Brown explored the surrogate's knowledge of the patient's wishes? He said, "Have you ever had a chance to talk with your mother about the type of care she would want if she were to become very sick?" Did you notice how Dr. Brown acknowledged and normalized the challenges of honoring the wishes of someone you care about? He said, "It must be really hard to think about your mother getting so sick." Did you notice how Dr. Brown provided a recommendation based on the patient's previous decision? He said, "Is it okay if I make a recommendation? I am worried that your mother's breathing may get worse very soon. Understanding what is important to your mother, I would recommend that we do everything we can to help your mother's breathing feel better." What thoughts do you have about that? In an emergency, it can be challenging to know how best to proceed when presented with a post form that places limits on medical care. Following a simple framework can help confirm if a patient's current wishes are consistent with previously documented wishes in a way that respects patient autonomy and facilitates prompt, goal-coordinated care. If current wishes are discordant with previously documented wishes, a new goals of care conversation is necessary. When a patient is unstable, providing care necessary to stabilize may be first required. These conversations are scary. Statements that normalize and empathize can be helpful to address the emotion. These conversations can be confusing. Clear and simple, patient-friendly language with opportunities for patients to explain their thinking can help avoid confusion. When speaking with a surrogate, it is easy to be distracted by what the surrogate wants for the patient. It's important that the patient's wishes drive decision-making. Here we provide some simple language that can be used to describe some common medical terms. We hope this framework presented here will help you feel more prepared to communicate with a critically ill patient about what matters most. Thank you.